But we know as Catholics that human suffering, when united to Christ and his suffering and death on the cross, bring everlasting value not only to the souls who turn their lives to Christ through that suffering, but by the means that suffering has for the benefit of all humanity. We as healthcare providers have always been blessed by the rich tradition in Christian nursing standards of ethics to never provide a serum or a prescription to end the life of those we care for. The American Nurses Association Code of Nursing Ethics has clearly identified the role of the nurse to be the advocate for all those who suffer and who are ill, and to provide for them the advocacy of all means, of normal means to continue care of that person. That role of advocacy includes sitting with people, spooning them food, even if it drips from the side of their mouth, to lovingly nurture them and value their life through simple acts of kindness and love. Our Lord himself talks about Christians' responsibility with many stories about his healing. But perhaps most noticeably, Christ teaches the story of the Good Samaritan who picks up the suffering and seemingly dead off the side of the street and provide loving care and support and says, do anything you need to provide the care for this person. Nurses are called for that. Healthcare providers are called for that service. With the new revisions of the fluid document of the Nursing Code of Ethics, language is slowly changing to indicate that nurses should never participate in a patient's request for medical aid in dying, to a more neutral standpoint in that response. We as Catholic Christians must advocate for legislature that never takes away conscience protections from nurses and doctors, allowing them to refuse to end the life of a patient because they simply request it. This is important. Healthcare committees and hospital systems was a standard of the Joint Commission accreditation for all hospitals in the United States of America. In just the last few short months, this Joint Commission standard is beginning to change, and an ethics committee consult may not be required in hospitals, depending upon hospitals' needs to continue this practice of providing ethics consultations for all patients and families while being cared for in hospitals across the country. The new Joint Commission standard is going to change the name of the requirement for hospital ethics committees into a human rights committee. This becomes potentially dangerous when the absolute autonomy of an individual patient expresses the right to request medical aid in dying in healthcare systems. We witnessed rights being taken away from doctors and nurses during the COVID-19 pandemic, and we do not want to see further rights of hospital providers being taken away from the practices of those who aim to heal.